Why do surgeons always say, trust the process?
I always told you, rhinoplasty is a long journey. What we are doing in rhinoplasty, we are always open the skin and reconstruct the skeleton and cover your original skin. There is a gap between the skeleton and skin, and this gap filled by your body reactions, some scar tissue, some fibrosis tissue, and during the surgery we try to control your body reactions, but it takes time. For example, the stitches will dissolve by themselves around until 8 months. Some of stitches will dissolve around 3 months. Also, the gravity will affect the results. Also, the swollen, some body healing factors like hormonal factors, some genetic factors may affect the results. And we always think long-term results and take some actions during the surgery for your long-term results. We will see the final result after 6 months until maybe 18 months. This is the long process and you need to trust the process always.
Is rhinoplasty more challenging for patients with thick skin?
Actually, it is not only thick skin. Sometimes thin skin is a challenge because we are reshaping the skeleton according to your skin type. If you have thin skin, for example, your skin cannot camouflage some minor irregularities or some minor body reactions, body healing response. But if you have thick skin, this is another problem. In this situation, we cannot give a shape to the skin if you have thick, oily and poor skin. Of course, we have some tricks to control and manage your skin reactions. For example, some stitch technique, some skin thinning procedures we can do during the surgery, and we try to manage your skin problems. Disadvantage of thick skin mostly is healing period because thick skin have longer healing period than the thin skin patients. If you have thick skin, you will see the final results after 1 year. Also, if you have poor oily thick skin, we need to control your oil production after the surgery with some medicine, some treatments, maybe some recommendations.
Is there a perfect age for rhinoplasty?
This is a very common question, honestly, because yes, there is an ideal age for rhinoplasty after 18 years old until 45 years old. This is an ideal age. Because we know that after 40-45 years old, the elastic fibrils, collagen fibrils become poor on your skin. And if your elasticity become poor, your skin cannot camouflage very well, cannot stretch very well over the native skeleton. But in rhinoplasty, we need to tight your skin over the native skeleton. In early age, for example, 20 years old, 25 years old, the skin camouflage and stretch very well over the native skeleton, but after 45 years old, it is a little bit difficult. And your expectations should be realistic after 45 years old. But of course, we have a lot of patients after 60, 65, my maximum age 67, for example. We can manage the skin. We have some tricks for manage the skin problems. Ideal age is before 45 years old, and your expectations should be realistic in these ages.
Will I be able to contact you after my surgery?
Of course, rhinoplasty is not one-day surgery. It's a very long journey. You need to contact us. Actually, we encourage you to contact us for your follow-ups, especially first month, 6 months, and first years. Also, if you have any question, we have a lot of channels to contact us. For example, you will have a post-op WhatsApp group, and you always can contact us, and our post-op team always available. Also, my special post-op Instagram account available, and you can text directly to my Instagram account, Dr. Unique Instagram account, and our post-op team can reply you as much as quickly. Sometimes I can reply your questions too.
What's the most important part of a rhinoplasty consultation?
I enjoy the consultations because during the consultation we know each other very well, and this is the first step of rhinoplasty. If I understand your expectations, if I explain myself, my surgery plan, my limitation about your anatomy, about your genetic, we can be happy after the surgery too. During the consultation, after listening to you, I customize your surgery plan and I try to explain what we can do and what we cannot. The most important part of your surgery is to tell me your expectations. Most of patients show me a result that they want, but the more important one is what you don't want. If you show me some examples, for example, I don't like this picture, I don't like this nose, I like this nose, we can discuss and decide together. At the end of the consultation, to decide tailored, customized, harmonic results for you.
Can rhinoplasty improve both breathing and aesthetics?
This is my field because I am ENT surgeon. The most important, my priority, always increase your breathing. If you have septum deviation, turbinate hypertrophy or anything else, I always look inside with the camera and fix the breathing issues. After the surgery, you will breathe very well. This is my priority. And then we are looking outside aesthetically, and I never do weak nose. I always try to stronger nose for your breathing. And yes, rhinoplasty improves both breathing and aesthetic.